The past year has taken a toll on the mental health of many Canadians, whether they realize it or not. And the people we turn to, psychologists, councillors, and therapists, are also bearing a heavy load, guiding people through these troubled times. Ross Lord looks at how the people caring for our mental health are coping with their own.
Ever since the pandemic started, nurses and other healthcare workers have been rightly singled out for their courage and endurance. But another group on the front lines has been largely ignored: mental health professionals.
I would say there's a fivefold increase in people seeking help, and people are entirely correct to be seeking help in these circumstances.
Dr. Simon Sherry says turning away people who need help in Nova Scotia's underfunded mental health system has left him stressed out.
You're helping people with the problem while also suffering the ill effects of the problem at the same time.
A predicament they don't normally discuss publicly. Some pandemic adjustments they've made with clients are easier to share than others, like switching to virtual sessions.
They go to their car and go out into the middle of an empty parking lot because that's the only place they can get privacy. Or people who have large families, young kids. I've had sessions take place within sheds, walk-in closets.
The downside for everyone is inescapable. In a survey posted by Statistics Canada in February, 70% of healthcare workers reported their mental health was either somewhat worse now or much worse now than before the pandemic. When asked how stressful most days are for them now, more than half replied quite a bit stressful or extremely stressful. Like other studies of its kind, it did not include mental health professionals, who are also struggling with compassion fatigue and the threat of burnout.
You can't provide support and care to others unless you're in a centered space and able to provide that to yourself.
Psychologists need psychologists too.
Sherry says in addition to monthly peer support meetings and mountain biking, he turns to his family for support.
So one of my key coping tools was to go home and walk around the living room with my baby every night. It was good to hold that little guy and to feel close and comfortable with him.
Coping while hoping the pandemic ends soon. Ross Lord, Global News, Halifax.